Gary Peters now joining us on the Oakland County Megacast. Senator Peters, thank you for taking time with us today. How are you? How's your team?
I'm well. It's great to be with you. Hopefully both of you are staying healthy and safe.
We are doing our best. Thank you very much for your good words. So COVID-19 has obviously presented a number of challenges to the government on all levels. From a federal standpoint, what have been some of the most significant challenges that you and other senators and representatives have been facing?
Well, it's been a long list, as you mentioned. I've been in the center of this to a considerable extent as a result of the fact that I'm the ranking member, which means I'm the top Democrat on the Senate Homeland Security Committee. And in that committee, we oversee FEMA. And of course, that's the federal emergency management folks who are entrusted with the federal response. And so I've been involved on a daily basis. My committee staff talks with FEMA folks daily. Certainly our biggest challenge initially, especially here in Michigan as one of the hotspots in the Detroit area in particular, was just making sure we had basic supplies like basic personal protection equipment for our healthcare providers. And in the initial stages, we had a scramble everywhere to try to make sure we had those supplies coming into our state. Testing supplies, which continues to be an issue, but we need to be able to know who has the disease and who doesn't, and then do the contact tracing. So all of those supply issues and the supply chain, which unfortunately is primarily reliant on foreign producers for some of the key equipment we need from medical supplies to life-saving drugs. We have an over-reliance on foreign providers. We've got to take that back. We've got to bring it back to the United States. It's a very clear lesson. And in fact, it was a lesson that I put out last year. I put out a report from Homeland Security talking about drug shortages and the fact that we're over-reliant on foreign producers. And when there's a pandemic, we're going to face a very critical situation. And here we are in the pandemic. It's no longer theoretical. It's real. And we have to come together in the months, years ahead to make sure that we have a more secure supply chain for critical supplies that we need to deal with the pandemic and what will likely be future pandemics.
U.S. Senator Gary Peters with us on the Oakland County Megacast. You talked about earlier on in the pandemic when when of course the state of Michigan and other states throughout the union, really all states in the union, were facing massive shortages in PPE, right. And that created some competition to a certain extent between the states. And on a federal level, as you and other members on your committees and within the federal government are working to solve these issues, you have to be able to put politics aside in order to help not only your state, but other states. During the pandemic, have you seen that the polarization that we're experiencing in our country has kind of been put maybe to the wayside to solve these issues? Or has that gridlock continued to be an issue in solving a lot of these major problems?
Well, some of it we put together. I mean, obviously the CARES Act, which was a major support. We talked about supply shortages, but clearly we have to, in addition to dealing with the public health crisis, we have to deal with a just monumental economic crisis with incredibly high levels of unemployment. And something that I worry a great deal about is to make sure that our small businesses survive the pandemic. As we start reopening and get an economy up and running again, it is very difficult to do that if small businesses are not in business. So that's why the Paycheck Protection Program, the expansion 7A loans, all of that was so important. And I bring that all up because it came through the CARES Act, which is $2 trillion of relief, but it passed unanimously. So we did come together with that, and the two previous bills prior to that brought that together. But I will say the frustration for me in working with supply issues, particularly, as you mentioned, with states around the country, is that we had an administration that basically said, every state, you're on your own, go out there and fight for what you can get. And we had a situation where governors literally had to compete and try to outbid each other for the supplies that were out there, when the role of the federal government should be coordinating that. And that's what FEMA traditionally does. If you have a hurricane that hits a region of the country, FEMA uses its purchasing power, the checkbook, to buy resources necessary to get through the crisis and to get people back up on their feet. And you do it in a coordinated regional way. That same concept should have applied nationally. The difference being we had a hurricane that now swept across the entire country, and we had to have a national approach for that. And understand, particularly at the very beginning of it, when we had just a few hot spots that were taking a tremendous toll in terms of the disease spreading and deaths, that you really have to treat that as like a triage situation in a hospital where you have limited resources and a lot of patients coming in. And you have to determine those who are the sickest to get the help first, and those you can help survive. We were in that situation, and yet we didn't see the the national response coming from the administration necessary to do that, which caused a lot of confusion, caused a lot of problems. And even now, I would certainly think that we should have a more coordinated response when it comes to testing supplies, for example, as the need for these supplies actually are increasing as we're opening the economy. We need to make sure everybody has access to personal protection equipment, that people feel safe going out. In addition to opening up a business, you also have to make sure your customers feel safe to actually go to that business, or the business can't survive. So we've got to deal with that public health aspect, and that includes testing to make sure we know who's sick and who's not, and people have the peace of mind to know they're not sick and they can go to work. All of those factors require a coordinated national response when you're dealing with a crisis of the magnitude that we're facing right now.
Hindsight being what it is, you look at that early scramble for resources that was in many ways disorganized on a national level. And does that provide any sort of discussion within the Senate, bipartisan discussion within the Senate, within the House of Representatives, within the entirety of the federal government going forward for the next pandemic? Because it may not be until another 100 years from now, and maybe in the next 10 to 15 years. We don't know. Is there anything in place now that's being discussed or that's being worked on that is down the pike that is going to prevent in the future these kinds of mad scrambles that cause severe issues throughout the country?
Yes, there has to be a complete after-action analysis of all that. My committee will be in the center of that, where it's Homeland Security and Government Affairs. And we're the top oversight committee for the U.S. Senate. So we do the oversight to make sure, one, that we're spending money appropriately and that there's not waste and fraud. But also, how do we prepare for emergencies going forward in a more coherent fashion? So we definitely have to do that. We did have some pandemic plans in place prior to this, but there were cutbacks. Those should never have occurred. So we're going to be looking back. Right now, I think we're in the phase now where we need to be thinking forward still about a potential resurgence in the fall. So a lot of the efforts we're putting forward right now is just making sure we're taking care of the immediate needs. But you're absolutely right. There will be another pandemic. It's part of human history. We've had pandemics throughout our history. We're going to have it again. There's also the likelihood, given the fact that the population continues to grow on our planet and we are more interconnected than human race has ever been, so the spread of a disease can occur a whole lot more rapidly than had happened in the past, where you could isolate people more effectively than you can today. So this is a serious issue. We're going to have to, I think there's a number of things as we look forward. One, we have to make sure our stockpiles are large enough to deal with the kind of surge that we could see in another pandemic. But it really goes back to the point that I mentioned at the beginning, too, is that we have to have a resilient supply chain. We have to have manufacturers in the United States making critical supplies going forward. And for example, when it came to testing supplies, one of the things that has been a limiting factor is just the production of cotton swabs. The cotton swabs that you put up your nose to get a sample. There's only one manufacturer in the United States that makes those. They're mostly all made in China, and we're reliant on the Chinese. And when you're in a pandemic, every country in the world is also going to China trying to buy that equipment as well. So we have to identify those key areas and invest in those. It's related to what I do as a member of the Armed Services Committee, which oversees the military. And I think about constantly the supply chain for the U.S. military. And for example, we do not build U.S. Navy warships in China. We make sure we build them here in the United States of America. We make sure we have shipyards with the capability to build warships. Here in Michigan, right across the border up in the UP, in Wisconsin, right on the border with Wisconsin and Michigan, we have Marionette Marine that makes the littoral combat ship and then the Navy's next generation frigate. We have shipyards here to do that because we can't be dependent on another country should we go to war. The same concept has to apply for life-saving drugs, the medicines, the supplies, that we should not be dependent on another country for those kinds of life-saving supplies. We need to bring them back to the United States, take it back. It's good for jobs, employment. At the same time, it adds to our national security. So in my mind, it is a true homeland security issue, and we have to make sure we have that kind of resilience. So, the economy has always been moving to a really high efficiency, low cost, just-in-time delivery, which is great when times are good. But what we find out in a pandemic or in a crisis, you better have resilience too. You better have the ability to make sure you still have control of that supply, or you can find yourself in real trouble.
U.S. Senator Gary Peters with us on the Oakland County MegaCast. Senator Peters, you recently released a 17-page report in regards to federal relief aid distribution from the Federal CARES Act, and it detailed some significant disparities in distribution of this aid. Provide an overview, please, on what those disparities are and how that impacted the response in the states that were affected.
Well, you're right, and it's part of, again, out of the government affairs part of my committee, the oversight. So we wanted to see exactly how money is being spent from the CARES Act and substantial money going to healthcare providers. There's no question that they have been impacted in a significant way, in a negative way, and it continues. Dealing with COVID, our hospitals had to stop doing the normal kinds of procedures that they do for patients, which pays most of their bills, and they had to free up beds for COVID patients. You also now are in a situation that even as those cases have gone down, you still have people who don't feel comfortable going to a hospital because they're concerned about COVID, and so they're facing significant financial pressure. We understand that. We need to continue to provide it, but we actually looked at the $170+ billion that was provided in the CARES Act to help our hospitals and providers get through the crisis. And as of the report date, which was just a short time ago, over 40% of that money still had not been distributed to healthcare providers. And this is legislation that passed back in March. We're now in July. We're talking over $70 billion. And as a result of that, you've seen a lot of our hospitals here locally in Oakland County and in Southeast Michigan, you've seen our hospitals lay off people and furlough folks. It's estimated some 10,000 healthcare providers have been laid off or furloughed when money was available to keep those folks in their jobs and to restart what is critical. The other aspect that was very concerning is that because that money has not and still hasn't been put out as rapidly as it should have been, it really puts our rural hospitals in a significant financial crunch. Already a large percentage of hospitals in Michigan prior to the pandemic, rural hospitals, were considered to be in severe financial difficulty and may have difficulty surviving. And if they don't survive, that puts rural residents at a real problematic place in that they have to go a very long distance to get some very critical health treatments for them. And now with the pandemic and the fact that this money has been slow getting to those rural hospitals, we continue to be very worried that many of them may not survive.
U.S. Senator Gary Peters with us on the Oakland County MegaCast. That the national average of allotment aid from the Federal CARES Act to these hospitals was about $160,000 per patient. In the state of Michigan, your report found that average was right around $31,000. That's no small difference. That's a significant difference. How do financials get thrown that far off in aid that's this critical?
Yes, and that is the other major finding in the report too, as you mentioned, is the significant difference per patient. And that's because of the way it was distributed out just across the geographic basis. And it was not based on the actual need of particular hospitals and those that have been hit the hardest. So as you mentioned, the numbers for Michigan are considerably less per patient than you have in other areas around the country. And with that finding, one of the recommendations is that we have to make sure that those places that have been impacted the most are the ones that receive the resources. The resources are meant there as emergency aid to help health providers and to help localities that are being impacted by COVID. It's emergency aid. Not just across the board blanket money passed all across the country. It should be actually targeted to where the need is the greatest.
Senator, if I can ask you a quick question, talking about those resources, a lot of people got the unemployment benefits and they needed those unemployment benefits. The federal benefits are scheduled to run out at the end of the month. Do you expect those are going to be extended? Because one thing I'm hearing from businesses trying to reopen is they can't get employees to come back because they're making more money with those federal unemployment benefits.
Well, yeah, you're right. In addition to the normal unemployment that someone would qualify, there was a $600 per week additional payment made through the end of July. So at the end of this month, those will go away. The reasoning for the 600 came from the administration. The original thought was that you'd replace whatever their income would be replaced, but it was an assessment made by the Department of Treasury that most of our states' unemployment systems are antiquated, and that to try to customize it to that extent, at least what we heard from the Treasury Department, was that it would delay the checks sometimes substantially. And certainly the initial thrust of the unemployment help was that folks needed money in their pocket as soon as possible. A large number of folks in our country, after one paycheck is missed, they're in a fairly difficult position. And if two paychecks are missed, it can be catastrophic for a lot of families who've suddenly found unemployment come really out of the blue for them. So we had to get it quickly. I will say on the 600, two questions there. On the $600 extra per week, one thing that is very effective here in Michigan, and part of the law was to strengthen these programs, is a work share program. And so if you hire back, or if you offer a job to an employee who you laid off, they have to come back to work. So, or they lose their $600. So they do have to come back for that. But if you want to bring other folks with a work share program, you can actually bring people in. And a lot of businesses now don't need full 40 hours. They need reduced hours. But if you bring someone in and they could work half-time or more, if they work 20, 30 hours a week, you pay them for that. But they still get their unemployment on top of that. So it's a really strong incentive. They can really make even more money by coming back to work. So there is a strong incentive to do that. As to whether or not it'll continue beyond July, that's still open to debate. The House passed legislation to do that. We're in the process of hopefully moving additional legislation for those areas that continue to need help by the end of July. But I'm back in Michigan now. We're in Michigan. I'll be in Michigan. And we're all back in our home states for 2 weeks. And so during the last 2 weeks of July, it's our intent, hopefully, to look at various aspects of the CARES Act and take whatever action is necessary to help people get through the crisis.
U.S. Senator Gary Peters joining us on the Oakland County Megacast. So we talked extensively about the Federal CARES Act, about unemployment assistance from the federal government. Also coming down the pike has been the HEROES Act, a potential second supplemental package from the federal government. We've heard Governor Whitmer talk about how that aid would significantly help, particularly funding our schools in the state of Michigan. Can you go into details about what the HEROES Act would entail in terms of aid and how that would benefit these states?
Well, the HEROES Act is the act that came out of the House, which provides substantial resources for state and local governments, including school districts. There's no question in my mind. We need to make sure we're providing help to our state and local governments who have been impacted. Revenues have dropped dramatically. If you think in this state, over 20% of the population's on unemployment right now. That's a massive number of unemployment and not tax revenue that's not coming in. And yet a state needs to continue to provide services. First responders, law enforcement, that our local communities provide is all critical. And clearly education, as schools hopefully are reopening safely in the fall. But states don't have the same kind of flexibility the federal government has. The state of Michigan, for example, has a balanced budget amendment. So in order to compensate for those drops would mean huge cuts across the board to critical services that are provided to people here in Michigan. And that's where the federal government can be helpful to provide those resources going forward. So we're hoping and fighting to get those resources in the package that comes out of the Senate. Right now, the Republican caucus in the Senate and Mitch McConnell is not as open to providing that kind of help for state and local government. So we're gonna try to negotiate and find some common ground so we can get it passed and get help to where it's needed.
U.S. Senator Gary Peters with us on the Megacast. Senator Peters, just a couple more minutes with you. Anything else that you'd like to touch on before we let you go today?
Well, I think it's important that we continue to stay focused on the need for all of us in this crisis to make sure that the numbers stay down. And I concerned with what we're seeing is the spike in cases, particularly in some of the southern states in Florida and Arizona and Texas. And I know it's natural. We're all want to get back to a new normal, but it's really incumbent that all of us continue to practice the kinds of personal behavior that's really critical for us to stop to slow down, to slow down the spread of this virus. So wearing a mask, maintaining social distances, not accumulating in groups is still necessary because the virus hasn't gone away. It's still out there. There's a lot of concern that we may have a resurgence in the fall as well. And we have to make sure that we're able to, not overwhelm our healthcare system with people who are very, very sick. And at the same token, also start getting our economy back going and running again and start getting back to whatever that new normal is. So whenever I get an opportunity to continue to mention that we still have to do our part. We have the power in our hands. Each one of us individually have the power in our hands to really minimize the spread of this disease dramatically by wearing a mask and doing those things. And I would hope folks would remember, when you wear a mask, yes, you're protecting yourself, but you're really protecting everybody around you. It's everybody else benefits from that mask. So when you wear that mask, you're making a statement that I care about society, I care about community, and I care about you. That's why I'm wearing a mask, because I don't want you to get sick and spread that around to other people in our communities. And I hope we all take that to heart, practice that, and know that together we're going to get through this.
Well, Senator, thank you very much for being with us today. We appreciate you taking the time.
Thank you.
U.S. Senator Gary Peters with us on the Oakland County MegaCast.